السلام عليكم طلاب. اليوم عندنا اللاب التاسع اللي هو يحكي على الليمفاتيك and lymphoid tissue. عندي lymph organs. Lymphoid system is a part of the hematopoietic system represented by the central, primary and the peripheral secondary. Central primary, where the new lymphocytes are produced from the bone marrow يعطيني ال B cells from the thymus يعطيني ال T cells. زين peripheral or secondary lymphocyte where the lymphocyte are respond to the antigen. لما الليمفوسايت مالتي تستجيب للانتيجين وين؟ بالليمف نود وبالتونسلز وبالسبلين. ونمبر 4 بالميوكوزا associated with the lymphoid tissue. هاي السنترال والperipheral. Now, the function of the lymphatic system. Number 1, absorb the fat and the vitamins from the digestive system. Number 2, drain excess fluid from the tissue. Number 3, return the waste product and the extra fluid to the circulating system. Number 4, immunofunction. Now, a lymph node. The lymph nodes are bean-shaped organs found in the cluster around the distribution of the lymph channel. Every tissue supplied by the blood vessel also supplied by the lymphatic except البلازنت and الري. يعني أي tissue دا يحتوي لي يجهز لي بالبلد فيزل هو أيضا دا يجهز لي بالليمفاتيك ما عدا البلازنت and البرين المشيمة والدماغ. Histology capsule the outer cortex and the inner medulla يتكون لي. هذا الليمف نود هذه الكبسول موجودة بالخارج وعندي الكورتكس وعندي الميدلري بتصنيفاتها. Now عندي الليمف نود عندي هذا الكونكتيف تيشيو وعندي الكورتكس هاي أشرح عندكم والميدولا البارا كورتكس الليمف نود والترابيكولاي والميدولاري ساينس والميدولاري كورد. Now, the primary follicles. In the absence of the immunostimulation, with secondary follicles on the germinal center in the presence of the immunostimulation. Now, the pathology of the lymphoid tissue. The major alteration involve the blood, lymph node, spleen, and the other organs. And the lymphadenopathy is a common and the most prominent in the posterior cervical, axillary, and the groin region. The spleen is enlarged in most cases, weighing from the 300 to the 500 gram, exhibit heavy infiltration of an atypical lymphatic Now, the pathology of the lymph node. Inflammatory reactive hyperplasia infection with tumor. عندي reactive lymphoadenitis. Infection and the non-microbial inflammatory stimuli often activate the immune cell in the lymph node, which act as a defense barriers. Infections cause the lymphoadenitis, which is either non-specific, acute, or chronic. Specific, number 1, البكتيريال عندي التوبركلوسيس والسيفيلس والبروسيلوسيس، والفيرال هي الانفكشيوس مونونيوكليوسيس، والفنجل هو الهيستوبلازموزيس، والباراسايت هو التوكسوبلازموزيس. عندي الأكيوت non-specific lymphoadenitis. It not drain the local infection or generalized systemic infection and the inflammatory condition. Clinically, swollen, tender, fluctuant. If there is abscess overlying the skin is red. Histopathology. The large germinal center, numerous mitosis, neutrophils around the follicles if the cause is the biogenic. Necrosis in the severe infection lead to the abscess formation. The outcome if the infection control the lymph node revert to the normal, but if damage so undergo the scarring. The acute lymphoadenitis is the most often seen in the cervical region due to the microbial drainage from the infection of the teeth or tonsil, and in the axillary or inguinal region secondary to the infection in the extremities. Similarly, acute lymphoadenitis often occur in the mesenteric lymph node draining acute appendicitis. هذا عندي السلايد show this. Now, the chronic non-specific lymphoadenitis, 3 pattern: follicular hyperplasia, الباراكورتيكال hyperplasia, والsinus histiocytosis. Characteristically, lymph node in the chronic reaction are not tender, but their capsule are not underlying increased tension. The chronic lymphoadenitis is particularly common in the inguinal and the axillary node, which drain relatively the large area of the body and are frequently challenged. Histopathology, germinal center with chronic inflammatory cells, necrosis of the entire follicle, fibrosis, and the thick sinus wall. Now, follicular hyperplasia. This is caused by the stimuli that activate the B cells, which migrate into the B cells follicles, forming the follicular reaction. A reactive follicle, numerous B cell, scattered T cells, phagocytic MQ contain the nuclear debris, tangible bodies. It causes the rheumatoid arthritis, toxoplasmosis, and the early HIV infection. Differential diagnosis: follicular lymphoma. Now, الfollicular hyperplasia بالسلايد A low power view showing a reactive follicle and surrounding the mental zone. The dark staining mental zone is polarized, being much more prominent adjustment to the germinal center, light center in the left half of the follicle. The right half of the follicle consists of the dark zone. Now, slide B, high power view of the dark zone shows the several mitotic feature and numerous macrophage containing. Now, paracortical lymphoid hyperplasia. This is caused by the immunoreaction involved T cell region of the lymph node that encroach on and sometimes appear to efface the B cell follicles within the interfollicular region. Activated T cell immunoblasts are observed. These T cells transform into the large, 3 to 4 times the size of the resting lymphocyte. Proliferating the immunoblasts have the round nuclei, open chromatin, several prominent nuclei, and moderate amount of the pale cytoplasm. In addition, there is hypertrophy of the sinusoidal and the vascular endothelial cell and the mixed cellular infiltrate, principally on the macrophage and sometimes of the eosinophils. Such changes are encountered in the immunologic reaction induced by the drug, especially phenytoin, in acute viral infection, particularly infectious mononucleosis, and the following vaccination, smallpox. Now, sinus histiocytosis. This refers to the distension and the prominence of the lymphatic sinusoid, often in the lymph node draining the cancer. The lining lymphatic endothelial cells are markedly hypertrophied, and the macrophagocytes are greatly increased in the number, resulting in the expansion and the distension of the sinuses. In the setting of the cancer, this pattern of the reaction has been thought to represent the host immune response against the tumor or its product. Now, infectious mononucleosis, acute self-limited disease, Epstein virus, infection in adolescent young adult, clinically fever, sore throat, and generalized lymphadenopathy, peripheral blood lymphocytosis. Now, diagnosis by the serology: atypical lymphatic cell in the peripheral blood, positive heterophil reaction when increased titer of the antibody specific for the Epstein-Barr virus antigen. Now الهيستوباثولوجي marked paracortical hyperplasia وانكريز بالسمال راح يصير عندي زيادة انكريز small lymphatics الليمفوسايت أو الليمفاتيك سيلز البلازماسايتويد والإميونوبلاست والR2S cells الهيستوسايت and the plasma cell والفوكي of the coagulative necrosis وباللate stage effacement of the architecture will outcome mostly resolve within in the 4 to 6 weeks occasionally develop a complication differential diagnosis الليمفوما. هاي نفس ما توضح عندكم بالسلايد والسهم. Now tuberculosis lymphoadenitis the commonest form of the extrapulmonary tuberculosis especially in the children and the young adult but may occur at any age caused by the Mycobacterium tuberculosis. Number 1. The acute type usually in the children under the 5 years clinically painful, tender and evolve within few days. Number 2. The casating type most common in the adult. Clinically the lymph node moderately enlarged and matted together. The patient may be present with the fever, anorexia and the weight loss. Diagnosis acid fast bacilli استخدم له شنو زيل نيلسون ستين بالسبيوتم أو السيربروسبينال فلويد أو باس. التوبركولين تيست الاي اس ار مالته زايد. الاكس راي تشيست is the mandatory for the coexisting pulmonary lesion. PCR will find needle aspiration and now histopathology granuloma الجازيوس necrosis المultinucleated giant cells من Langerhans giant cell. هاي الليمفوسايت هنا التوبر كلوسيس جرانيولوما هنا confluent granulomatous والمultinucleated giant cells and الابيثيلويد cells. هاي صورة السلايدات. Thank you طلاب.